Hi, I'm Dr. William Palmer with Westroads Rheumatology Associates. After receiving my medical degree from the University of Nebraska, I spent the next 5 years in Albany, New York at Albany Medical Center, completing a residency in internal medicine and a 2-year fellowship in rheumatology. For the past 38 years, I've been treating patients with moderate to severe rheumatoid arthritis. Recently, we've discussed adding a biologic to your current treatment regimen to help relieve the pain, stiffness, and swelling of your rheumatoid arthritis. This is an important step in your rheumatoid arthritis treatment journey, and in making this decision, I encourage you to take the time to carefully consider all your options. Learning everything you can about your biologic treatment options, including how they're taken, all safety considerations, and how much they cost, may help you feel more confident when deciding on a treatment path. I understand that office visits can be overwhelming, and remembering the information we discuss can be difficult. That's why this video was created for you. You can now watch this video and consider the different biologic treatment options we've discussed at your own pace, in the comfort of your own home, and as often as you like. You can also share this video with your family and friends so they can better understand your treatment options as well. In this video, I will review 5 key elements to think about: the benefits of biologics as a treatment option for rheumatoid arthritis, important safety considerations, the different ways they can be given, affordability and financial considerations associated with these treatment choices, and a few things to think about when considering which available brand option may be right for you. It's important that we work together to determine which treatment fits you and your lifestyle. This video is designed to help you do that. As you watch this video, use the tear pad I have given you to write down any important things you would like to discuss. These could be questions you may have about your treatment options or thoughts about how a treatment option may work for you. Open and ongoing communication is a very important part of an effective treatment plan and can help us meet your treatment goals. First, let's discuss the benefits of biologics. As with other rheumatoid arthritis drugs, biologics do not cure rheumatoid arthritis. Biologics work by helping to relieve pain, stiffness, and swelling in people who have not fully responded to disease-modifying drugs such as methotrexate. Many biologics are taken along with methotrexate. Let's go over some of the safety considerations with biologics. Biologics are medications that affect your immune system and can cause some serious side effects. We'll discuss whether biologic treatment is appropriate for you based upon your medical history. Before beginning a biologic, your health will be assessed and you may be required to have certain tests. We'll talk about which vaccinations you should receive and the best time to receive them. We'll also go over all possible side effects of biologic treatment. Next, I'll review some of the different ways your biologic treatment can be given to you. Depending on the medication, biologic treatments can be administered or given as an intravenous, also referred to as an infusion, or by a self-injection. Receiving an infusion and self-injecting are two very different experiences. Both ways of receiving your biologic medication are for moderate to severe rheumatoid arthritis and deliver the medication where it needs to be. The decision we will discuss together is which option would best fit your lifestyle. An intravenous or infused biologic treatment is given in my office by my infusion nurse. The medication is delivered through a needle that's placed in your vein, usually in your arm. Depending on the medication, the length of an infusion can be anywhere from 30 minutes to several hours, every 4 weeks to less frequently. Before your infusion, we'll check your vital signs and health to make sure that it's safe for you to receive the treatment. Then the infusion nurse will prepare and give you the infusion. You'll be monitored during and after the treatment. Self-injected biologic treatment is usually done at home after a nurse or I have properly trained you. You will inject the medication under your skin, either in your thigh or abdomen. The frequency of injections will depend on the medication, but the range is usually from once a week to once a month. You'll receive your treatment in an injection device that's pre-filled with medication and which needs to be stored in your refrigerator and disposed of properly after your injection. If a self-injected biologic treatment is right for you, we'll make sure that you feel comfortable self-injecting, storing, and disposing the medication as well as monitoring yourself for signs of infection. Now that we've reviewed 2 different ways to receive your medication, take some time to consider how the different aspects of each option might best fit you and your lifestyle. Affordability is another key consideration when choosing a treatment option. You may have some questions about how you will afford your treatment. The first step you should take is to carefully review your health plan's benefits and explore options for cost support, since coverage requirements and out-of-pocket costs can vary. If you have commercial or private insurance, biologic treatment may be covered under your plan's medical or pharmacy benefits, or both. Your costs can vary depending on how your treatment is given. You may also be eligible for out-of-pocket cost support offered by the company that makes your medication. Medical benefits usually cover infused or injected biologic treatment that is given by a healthcare professional. Pharmacy benefits usually cover biologic treatments that you inject yourself. If you have Medicare, biologic treatment may be covered under Medicare Part B or Part D. Your costs can vary depending on how your treatment is given. If you need supplemental assistance, there are foundations that may be able to help you. Medicare Part B usually covers infused or injected biologic treatment that is given by a healthcare professional. Medicare Part D usually covers biologic treatment that you inject yourself. If you do not have health insurance, you may find help through a private foundation. The affordability and financial considerations of treatment options can be a lot of information to digest. My office can assist you with questions about your financial options. So far, we've reviewed the benefits of biologics, their safety considerations, the IV or infusion experience, and the self-injection experience, with some financial considerations associated with biologic treatment. Our final consideration is which of the biologic brand options may be right for you. Together, we will discuss the available brands and make a decision based on our shared knowledge of your condition, your general health, preference, and health plan coverage. Moderate to severe rheumatoid arthritis is a chronic and progressive disease that requires frequent monitoring and a long-term commitment to taking medication. That's why it's important that we work together to find a biologic treatment for your RA that you are comfortable with and that you can consistently and successfully follow to help manage your condition. As you think about what we've discussed in this video, it may be helpful to ask yourself the following questions. How often is treatment given? How many infusions or injections are there per year? How long will my IV or infusion treatment take? How long will my self-injection take? Will the self-injection medication be delivered to my home? How will I store it? Will this treatment be covered by my insurance? How will I pay for it? Is there a support program I can turn to if I have questions or need someone to talk to? Thank you for taking this time to watch this video. Remember, the more you know, the better prepared you'll be to manage your rheumatoid arthritis. I hope this video has provided you with some helpful information as you consider your treatment options. You may also want to check out the additional resources section of this video for a listing of organizations that may assist you in learning more about your RA, different ways to connect with people living with rheumatoid arthritis, as well as rheumatoid arthritis advocacy groups dedicated to helping patients like you. I look forward to continuing our discussions and sharing this important decision with you.